So welcome back to this video tutorial series on pain management. I'm here with Dr. Diarmuid McCoy, Specialist Pain Medicine Physician. And in this next series of 3 webinars, we're going to be looking at the medications that are being used to help manage pain, starting off with opioids. Now, opioids is a drug that we've heard a lot about. And of course, they're often prescribed for pain, and while people who are suffering from extreme pain, of course, do need pain relief, the issue that we all know, of course, is that long-term use of opioids have got a higher incidence associated with overdose and death. So, Dr. McCoy, what's the deal with opioids? What are the considerations? When should you use them? And what, I guess, is the good, bad, and the ugly of opioid use in pain management?
Well, it's correct that we should consider the good, the bad, and the ugly, because all of these are associated with opioids. Opioids come from the opium poppy, and many of the opioids that we use now are actually grown from a poppy crop here in Australia, in Tasmania, for example. But it's a drug that has been around since ancient times. It's been documented that it was used in ancient China, in ancient Egypt, and yet we have had it for so long and we still don't fully understand all the nuances about such a drug. The good things about opioids, and we would be less of a human race because of them, is that they are excellent analgesic agents, excellent pain relieving drugs. And if you have your gallbladder out or your hip replaced or a cesarean section, you are likely to enjoy the analgesia, the pain relief from opioids. And that is probably the best place for them, for acute pain in the recovery room, after trauma, after surgery, or after an acute injury. They have been used, obviously, for cancer pain and at end-of-life care, sometimes in very, very high doses. And we would be struggling for managing cancer pain if we didn't use opioids. The middle ground is the patients with persistent pain. When do we use them? How do we use them? Do we use them at all? So let's talk a little bit about the opioid itself. The effects of it is analgesia, pain relief. It attaches onto an opioid receptor, of which there are a number of subtypes. And of course, if there are subtypes, there are different ways of different opioids connecting onto them and the effects that they cause. So should we use them? I use opioids. I use opioids as single doses, as single drugs for many patients. I take a lot of patients off opioids in the management of their pain. So they are not without their problems. Analgesia, pain relief, is the primary effect of an opioid, but we have some very significant side effects. Respiratory depression, decreasing a person's ability or rate of breathing, is a significant side effect to opioids. And of course, we've seen this with the heroin problem on the streets, but we've also seen with the so-called opioid epidemic that has swept across North America, parts of Europe, and to a lesser extent here in Australia. It's not as big a problem here, but it is a problem. Should we use them? Yes, we should use them in a small group of patients for as short a time as we can at the lowest dose that we can achieve. And we shouldn't really be talking about the opioids, we should be talking about the pain relief and, more importantly, the function that results from them. There are those who think we should never use them, and I think that would be throwing out the baby with the bathwater. There are a certain number of patients, a certain subtype of patients, who benefit greatly by opioids. Their function improves, their ability to get back to interacting with their family, going out on social occasions, and indeed going to work, driving, using machinery, and improving their quality of life. So opioids, the good, the bad, and the ugly. It's a huge subject, and one that we will pursue a little bit further in the next number of tutorials.
Okay, so thank you, Dr. McCoy. We're going to look at, in the next video tutorial, the different kinds of opioid medications and their different applications in pain management. We hope you can join us for that next webinar.